Alright, today I'm going to talk about how I coach people with chronic low back pain who don't have a lot of experience in the gym through a deadlift movement. Now I can justify this until the cows come home and talk about all the science and the research behind why it would be good for them. At the end of the day, this coaching and this actual demonstration of the exercise, getting them to feel for themselves, is always the most powerful. And so it's really important that I get it right, and it's really important that I keep it positive for them. All right, so I have an emphasis on simplicity. I only use 3 cues and slight variations of to get the initial movement. Now bear in mind that this person doesn't really have a lot of experience in the gym, so there's no way that I'm going to start with a conventional barbell deadlift with pumper plates on the side. This is something we work up towards. I'll talk about progressions in another video. Today I'm just going to focus on the actual cues that I use, so the language and the words that I'm selecting to make sure that the right messages that I want for the client to take away from the session. All right, I'll run you through them now. So before I get into the first cue, to help the learning process along, I normally get the client to stand side on with a mirror. So they've not only got my auditory cues to help them learn the movement, they've also got some visual cues to pair with the kinesthetic feedback, all right? So the first one is I always give them a small weight, okay? So get them to cues side on, and we're aiming to bend the knees, all right? Bend the knees is quite simple. That's literally the language that I do use, and it's simply to get a little bit of knee flexion. All right, so what this does can help sort of shorten the hamstrings a little bit, so they're not at such a length that we can get more hip flexion, all right, through the movement, all right? And that's the second cue that I'll lead up to, okay? But the first one is always bend your knees. Takes away the neural tension from that sciatic nerve in the back of your leg, makes things a bit more comfortable. All right, my second cue to follow on from having your knees bent is hips back and hips high, okay? So why, I'll run you through this slowly, but essentially, if you just give someone a cue of bend your knees and push your hips back, most people end up like this. Now you can deadlift from this position, there's nothing wrong with that, but I like to have hips high, so you get a bit more knee extension, all right, and a bit more purely sort of hip flexion, all right? That differentiates it from a squatting pattern, all right? Because we're just looking to change the muscles that we're using predominantly. And when I introduce the deadlift, or I'm coaching the deadlift, it's more about your hamstring and your glute contribution to the movement, because they're the drivers, all right? Particularly if you've got someone in pain and they're nervous about bending over, you can use this as a bit of a get out, and I do sometimes. Okay, I don't like bending, that's fine. We're not actually bending the spine very much here. We're loading it, but we're not actually moving or lengthening or shortening the muscles in the back. It's more about our hips, all right? So we're trying to strengthen those hips and the glute muscles to help us get stronger in that movement and build that function, all right? So your lower back doesn't have to do all the work. There's nothing negative about this. It's simply stating that we can improve our strength in our legs, which is necessary for a lot of this population, particularly if they're not experienced in the gym. Now the final cue that I use, it varies sometimes depending on the position, okay? The common mistakes that I see and common corrections that I make is that I've got the hips and the knees sort of fine, but the weight just sort of dangles too far out in front, all right? So that can just increase the lever length of the lower back. The easy fix is to say bring the weight a bit closer to your shins or to your midfoot, and that'll correct most of your thoracic positioning. If you do get a lot of flexion, sometimes just pointing at the mirror and say, try and keep a nice level between your hips and your chest will fix most of that, because they can actively cue out of that. If they're struggling, you can use cues such as puff your chest out or shoulders back, okay? Once we're there, we're standing up nice and tall. There's no doubt about that. There's a lot of evidence to suggest that you can lift in any posture. You don't want to drill into somebody that if they lift with a curved spine, they're going to hurt themselves, because that's the last thing we want someone with chronic pain to walk out of a session feeling. Okay, so I make a real point of emphasizing this is how we do this movement, all right, and this is a good method to make sure it's our legs doing the work and not our back. But I'm not saying if you don't lift this way, you're going to hurt yourself, okay? Because it's not true and it's not helpful.